Hi, I'm Christina McClurg. I will be discussing Panya, a 18-year-old female's communication and language difficulties. Panya's stakeholders that are responsible for her educational plan include herself, because she is 18, her guardians and parents, special and general education teacher, a aide, her therapist in speech, occupational therapy, and physical, and other team IEP team members such as school administrators, counselors that she may see. Some of Panya's communication challenges: she is mostly nonverbal with limited conversational speech. Many people do not understand Panya's communication. She relies on multiple modes of devices, ACC devices, self-created signs, pictures, gestures, and some words. She does not have the fine motor skills for sign language. She is reading at a kindergarten first grade level. She has limited sight word recognition because of that. And she does have some communication skills that does lack. Because of that, some of her behavior is restricted. She growls, spits, and has tantrums. So we will need to include those behaviors in some of the problems that we do see with Panya. Her verbal communication modifications should include clear and concise, simple language. We're talking to her in a slower, we're not giving her all the information at once. We're allowing extra time for her to process those, and we're using visual supports. Some non-communication modifications that we can use is gestures and facial expressions as she understands them, implementing visual schedules and cues, using social stories to explain situations and expectations of Panya, providing visual choices for decision making. We're also going to break tasks into smaller, manageable steps. For her, use hands-on multisensory learning approaches, incorporating Panya's interests. We're going to constantly provide feedback for her and use positive reinforcement. In all of this, we're making sure that we are following ADA compliance and ethical considerations. Sorry, my notes are on 2 pages. We are going to make sure that we are respecting Panya's dignity in all of this. We're keeping it confidential. We're providing equal access to her in all educational environments: general education, special education, electives, hallways, cafeteria. She's being included in everything. We're regularly reviewing and updating her IEP and interventions for her ADCC devices. We're training all staff members, families, herself, and any peers that may have interaction with her. And we're teaching her advocacy. We're going to foster an inclusive environment that promotes acceptance among her peers, teaching them about the disability and how to communicate with Panya in those situations. Some devices that we're going to use is the picture exchange system. She's going to have a high-tech device using either ProClue or GoToTalk that has the visuals so she can talk and make sentences with her family and peers and teachers. Visual schedules, understanding that daily routine will help her reduce some behavior and anxiety. Social stories, the acceptance and expectations of appropriate behaviors, and social environments. We're giving her those choice boards to provide decision-making skills and teach her how to make decisions. That is going to be available in all situations for her. One thing that we do want to work with Panya on is advocacy and being able to tell others about her communication needs. So we're going to include a communication passport that helps those that are communicating with Panya understand her disabilities and some of the communication styles and things that she will be doing to improve her independence. So we're going to work with ordering, talking to people, advocating for herself, just those simple things that we take advantage of every day. Thank you so much.